If you're someone that deals with chronic pain and tension in your neck and shoulders, I'm going to show you 8 exercises that when done regularly will reduce your pain and increase your mobility. Hi, I'm Lauren Irk. Welcome to Fitness Integrated Science. In this video, I'm going to go over 8 exercises that you can do to relieve tension and pain that you might be feeling in your neck and shoulders. Now, as a muscle activation technique specialist and personal trainer, I can definitely tell you that my clients come to me with issues around this area more often than not. Many of the reasons why we develop tension in this area is because of the things that we do all day. Maybe you're someone that's in an office and you're sitting all the time with a rounded posture. Maybe you're someone that has to work with their hands, reaching over the head or doing repetitive tasks. Whatever it is, the cervical spine tends to take on a lot more stress because of the fact that this part of the spine actually moves the best. If we look at the bottom of the spine, we look into the lumbar region of the spine, you're going to notice that the vertebrae are larger, they have less opportunity for movement, and they have a greater opportunity for load bearing. They're more about stability and less about mobility. Conversely, as we go up to the top, our neck moves up to 6,000 times an hour as we start looking all over our environment. We can move the head on the neck and the neck on the trunk, cervical and capital motion. This area of the spine is definitely not going to be a load-bearing area, but we can orient so many things with our cervical spine. This is one of the reasons why it gets beat up often. So I definitely recommend that you always pay attention to your core, keep your hips, trunk, and spine very strong. However, in this video, again, I want to go over some things that you can do that are going to be the opposite of passive stretching. Now, the thing that I want you to wrap your brain around is that if something is overworked, invariably something else is underworked. So it's the things that we're not doing, the muscles that we're not using, the positions that we're not going into, that's causing other areas of our body to have to work harder. So what do we have to do? We have to find those weak links and strengthen them, and that's exactly what we're going to do. Now, the shoulders themselves can move upwards and downwards, forwards and back. The upper arms can rotate, and we can certainly move into all kinds of different positions with our arms and shoulders. All the while, our head and neck is going to be affected. So for my first exercise, I'd like to try one motion, which is called retraction of the shoulders. Now, if you're somebody that has more of a rounded posture and you catch yourself with your shoulders always coming forward, you're going to notice that your head also starts to go forward, which really does put a lot of stress here right at the back of the neck. So getting these muscles stronger will really help. So what I'm going to do is I'm going to take a band. It can be any kind of a band, although you could certainly just use body weight by itself. And I'm just going to come up to a chair. So you could easily do this right at your desk. Placing your band on the chair, take your hands on top. Now, holding the band on one side, all I'm going to do is rotate my shoulders slightly inward so that the back of my shoulder actually faces up. From here, I'm just going to move my arm out to the side and up to the ceiling, paying special attention that I'm maintaining the position of my arm directly out to the side. Hold that for a few seconds and then return back to the center, making sure that I don't lose tension in the band. So this is going to directly work my rhomboids and primarily my rear deltoids, which is the back of the shoulder, that helps me to keep the shoulders on the back and maintain good posture. Now, when you're doing this exercise, you want to make sure that you're also doing it on both sides. We tend to have a difference in range of motion, and it is true that the side that moves less, the side that has less mobility and more tightness, is usually going to be your weaker side. So you may have to limit how far you go into the range. You also may have to limit potentially how much tension you use, maybe even getting a lighter sort of TheraBand to use. Now for exercise number 2, I want to move into the opposite motion, which is going to be protraction. It's the moving of the shoulders off the back. When we do things over our head or reach out in front of us, we're going to be needing these muscles quite a lot. And when they're not working, we get this elevation in the shoulders that can really develop pain. You see people grabbing their head and trying to pull. So I'm going to use a yoga block because it gives me an opportunity to change the position a number of times, which I'm going to demonstrate, but you can use anything like a book or a pillow or even just your hands. So first thing I'm going to do is I'm going to take the largest part of this block, which is here to here, and place it between the hands. Now when I start to press into it, my shoulders automatically have to roll off of my back. I start to feel chest muscles, maybe even some shoulder muscles. From here, as I push into that block, moving the shoulders into their fullest position of flexion, I'm just sort of handing off to different muscle groups as I bring the arms over the head and my shoulders are elevating into my ears and then bringing that back down. Now this is something that you want to practice all the time. This tends to be, believe it or not, an area that people are very, very weak in. And you're going to notice that if you have a rounded posture, it's next to impossible to get your arms over your head. So make sure that you're sitting up straight. I like this yoga block because now if you see if I turn it at a different level, it's now closer together, which, that makes it harder, right? Because those muscles have to actually shorten more to get my hands together. And I can turn it even one more level to go to here. And then eventually, as I get even stronger, I could completely let go of the block and just push my hands together. The harder you push together, the harder you're working, so you have to sort of modify that on your own. But those are great exercises to help you navigate your environment a whole lot better. Now, another exercise I'd like to show you, number 3, is going to be my pull-down exercise. And this is going to adequately train this downward rotation, depression of the scapula. These are the muscles that really do attach up into the neck, and they can actually make us feel like we're just all up in our ears, and you see people all the time trying to push their shoulders down. Maybe we need to train some of the muscles that actually draw the shoulder blades down to hold them there instead of stretching and massaging our neck all the time. So what I'm going to do is place this band right in between my hands and add a little bit of tension between them. From here, bringing the shoulders all the way up into whatever position of flexion you can handle. First thing I'm going to do is pull the hands apart. That helps me to draw the shoulders down out of the neck. Then I can stretch between the hands, pulling that band right down into my upper part of my sternum, squeezing my elbows into my rib cage, and then returning that right back to start. The band provides such a great tool to be able to access all kinds of planes of motions without me having to change my position to oppose gravity all the time. Now, if I want to work downward rotation, I also want to work upward rotation. This brings me to the classic shrugging exercise. Now, if you want to use a set of dumbbells, that's fine. You can also use a piece of tubing that's attached somewhere away from you so that you can line up those muscle fibers a little bit better. But what I want to do is I want to practice moving my shoulders up into the base of my ears, right at the jaw, and then lowering those right back down. Now, a lot of people like to do this exercise sort of rolling their shoulders in a circle, but if you notice, the muscles that attach are going to be right up in the back of the skull near what we call the occiput. So I want to make sure that I'm maintaining that thoracic extension. My shoulders are right below the ears, and you can see that I am moving my shoulders up into the base of the ear. This will help you not only to bring your arms over your head better, but it will also help you to turn your neck better. Sometimes what I like to do is maybe try things unilaterally to where when I'm actually elevating that scapula, I can look away and shorten those muscle fibers even more. Just a thought. Now, for my next exercise, I want to start moving into some of the rotational aspects of the shoulder, and this is going to be external rotation. Now, external rotation, which is this motion, the upper arm turning, sort of goes hand in hand with retraction exercises that really helps us to sit up straight. So let's say that I was sitting in a chair, although you could do this on the ground. I'm just going to put this band right around my feet, or you could attach it to a piece of furniture out in front of you. From there, get a nice attachment. I like to go into more of a thumbs up position to where it's in a neutral space. Then I'm just going to draw my elbows into my side ribs and then come into a slight position of abduction. Now the abduction piece is not necessary, but I'm just going to try it from here. From there, I just externally rotate through my upper arm bone, right, that humerus. This is external rotation. And you can see what's happening is that my forearms are now facing the wall behind me. Now without moving my upper arm, my humerus, I'm just going to return that back to the center. So I like to imagine that I have a rotisserie, right? And my upper arm bone is on that rotisserie that's attached to my shoulder, and I'm just spinning my forearms around that rotisserie. Now, if you don't want to go into abduction, you could also do this exercise from here, moving it out to the side. But I tell you, the best way to do this is to actually cross the band so that now I actually have some resistance coming across the body. Now, for my next exercise, I love the exercise called Scaption. Scaption is sort of cutting the difference between moving my arm out to the side as well as to the front. It's sort of moving on that 45-degree plane so that I can hit my middle delt, my front delt, and maybe a little bit of my posterior delt, not much though. So I'm just going to turn my thumbs up, which tends to be an area that a lot of people don't have as much pressure. We get a little bone called that lesser tubercle in the shoulder that kind of rolls away, and you may notice that it's much more comfortable to practice bringing the arms out to the sides. So from here, just moving the shoulders into that position, coming up, and then bringing that back down. This is a great exercise. The more that we train the muscles that sit on top of the shoulder, this will help so many of the muscles that support the globe of the head. Now, if you want to make this exercise harder, all I really have to do is change my body's position, such as if I move this chair away, I could try to come all the way down on the ground. I'm just going to do this body weight only, but if you see, if I come down flat on the floor, the first thing I have to do is come into extension, which means that I'm already working some of these muscles in the upper back, mid-thoracic, and cervical spine to not only hold my torso up, but also to hold my head up. Then from here, taking both of my arms out at that 45-degree mark, I'm already in a lot of position. Now, if you have a frozen shoulder or something like that, this may have already violated that range of motion. But I could certainly practice, lifting one arm off the floor and lowering it down. Look at my range of motion difference. Not very much. And I am feeling this working all the way down into my lower back. If this is too much, you could also come to your hands and knees, and now I have more range of motion. I'm still opposing gravity with my position on my upper back, but my hip is no longer involved. Plus, I am elevated off the ground. Now, one exercise that I truly love to do, number 7, is actually going to be capital extension, or we call this cervical flexion. So this is the chin tuck exercise. So if you think of holding your body flat as if it were on the ceiling, I'm just going to very lightly let the head move away from the ceiling. From here, I'm just going to tuck my jawbone in and try to bring the back of the head up towards the ceiling, holding it and then bringing that right back down. So this is going to be extension of the neck. I am actually moving the back of my neck on my body, and this is an area that gets so weak from looking down at our cell phones and sitting in chairs all day. Then for my 8th exercise, what I like to show is actually the capital motion, which is holding this position of the neck, but now adding the motion of the head on the neck. Now this, for some people, is a position that is very scary to train because they don't like to look backwards. But guess what? This is a motion that we need to be able to do. Notice I'm holding everything still, including my neck, and I'm just trying to move my head on a fixed neck position. Now, coming out of that position, what you're going to notice is that you feel much more upright, and the back of your head feels even with the back of your shoulders. Practice turning your head from side to side during the day, and also moving your shoulders. Remember, motion is lotion, rest is rest, as trite as that may sound. Now, if you'd like more information about other pre-hab and post-hab videos to actually help you to maintain your muscles from age 50 and beyond, avoiding injuries and rehabbing old injuries, head on over to my platform, Fitness Integrated Science TV. Also, sign up for my free newsletter that I hand out to give you more tips on how to improve the health of your muscles. Lastly, make sure you're subscribed to this channel. Hit the indications bell so that you never miss a video. Like this video and share it with your friends. Thanks for watching, and I'll see you next time.